How do you treat a child who has ODD or oppositional defiant disorder? And, it's a serious problem. If it's not treated early on, it can lead to conduct disorder, which is a really serious problem where children almost become like mini criminals. It's really extreme. So if it's not managed early, it really can progress into a lot of other more serious problems. And ODD treatment, it just depends obviously on the age. There's not one size fits all. And, it can present often just before children start formal schooling, where their behavior is extreme. They probably have started off as toddlers, having excessive meltdowns. They are children that started off maybe in the first 3 months of life were very colicky, often been treated for other problems like reflux and colic or milk allergy. And then later on, they're quite emotional children. They react easily. They react very quickly to easily frustrated. They can't calm themselves easily. Their responses are out of proportion. They hate authority. They can't be told what to do. You can't tell them at all. They don't deal with criticism. You can't criticize them. You can't correct them. And of course, when they go to school and preschool, these things are seen at a different level. So how do you manage these things? First of all, if this is part of ADHD, it's part of a self-control problem. The child doesn't have the ability to control. It's not that they're just a naughty child. They really don't have control of their emotional state. So, you can't walk on eggshells around children. You've got to help them. And medication does have a role. It makes a huge difference. It's life-changing. For parents who can't even go out as a family because of the ODD and the behavior, it can make a massive difference. So the medication can often help the child gain control to a certain degree. And then there are behavior programs for parents, helping parents understand what they should and shouldn't do because they feel overwhelmed. They don't know what to do. So there are behavior programs that are meant for parents. And there's an excellent book that I recommend. It's called not screen-free, but scream-free parenting. And you have a look it up. You can download it as a Kindle or it's on Takealot. And it really gives you an amazing insight into how to control yourself. The basic principle of the book is, in order to help your child with serious behavior problems or any behavior issues, you need to be in control of you. So if you have anger issues or not in control of you, you're not going to be able to manage your child. And then there's also behavior programs for the child. They're often behavior modification programs. Because a child with these problems, you can't talk to them. They know what they should do, but they just kind of react in the moment. So the treatment and help is helping the moment, making them accountable, having reward systems in place, not putting them in situations where they're overwhelmed, not giving them tasks that are overwhelming, making them into smaller little subsections, externalizing, making everything visible for them, where things are pictorial. They've got like pictures of what they should do in the morning with rewards. They are helped with their routines, taking a bit of time, a little bit more time to do things in the morning, getting up a bit earlier rather than rushed and under pressure. And then of course in the school environment, teachers understand that they've got to help them with their work, make things into smaller little bites, place them in the classroom where there's more supervision, and children that exercise better, do lots of exercise, they have better self-control. And then doing tasks and work in the morning rather than things that require a lot of mental effort, doing them later on. So I think, that would really, I think, make a big difference in the management. Management is holistic. There are excellent psychologists. If children have sensory processing problems, occupational therapists can really be a cornerstone of the treatment of this. children have learning problems, deal with those. It means that you've got to deal with everything that adds extra stress. But the cornerstone is understanding as a parent how to manage and what to do and what not to do.